First at 4. If you're a woman over 40, you should be getting screened for breast cancer every other year. That's according to new updated guidelines by the U.S. Preventative Services Task Force. That's an independent panel of researchers. News Channel 7's Jude Binkley talked to a doctor about why breast cancer screenings are so important for women.
Well, Doug, breast cancer is the most common form of cancer for American women, and it makes up about 30% of new cancer cases in women, according to data from the American Cancer Society. Now, a mammogram is an X-ray of the breast, and it's an essential tool for diagnosing breast cancer. The U.S. Preventative Services Task Force had previously recommended women get mammograms every 2 years, starting at age 50. Now, these new guidelines are more in line with what the American Cancer Society and American College of Radiology have been recommending. That's for women to start getting screenings in their 40s. Now, St. Alphonsus also recommends that women start getting screenings around age 40 and for them to be done annually. They say that anywhere from 1 in 8 to 1 in 13 women will have some form of breast cancer in their life. Now, Dr. Matt Moore is a radiologist that specializes in women's imaging, and he says the sooner you can find breast cancer, the better.
Breast cancer is something that's very curable if it's found early. When it's found late, it is less curable. And so that's why we are a big proponent of screening, because if we can find something early, then it can be treated and it can potentially be cured.
Now, Dr. Moore also says that it's hard to tell by yourself if you have breast cancer. You can't feel it. However, there are some cases where you can feel a lump in your breast or see a change. And if that happens, you'll want to talk to your physician and be evaluated. Now, usually breast cancer is rare for women in their 40s, but data from the National Cancer Institute says that breast cancer rate for women in their 40s has increased about 2% per year from 2015 to 2019. Dr. Moore also says that underserved populations are at a greater risk of dying from breast cancer, like those living in smaller communities who might not be able to get a mammogram at a center. And that's why St. Alphonsus has a pair of mobile breast cancer screening buses. Now, these screening recommendations are for average risk patients. Some patients who have a strong family history or a personal history of breast cancer might come in earlier than 40 for imaging to better evaluate and keep on top of the possibility of breast cancer.
It's so important to get screenings for breast cancer and so many other conditions as well. Jude, thank you for bringing that to our attention today.